Hi there, I'm Natasha Phillips. I'm Chief Nurse Information Officer for England, recently appointed back in May this year, right in the midst of the COVID pandemic. Over the next 15 minutes, what I'd like to do is share with you my thoughts on why it's really important that as nurses and midwives, we lead the digital transformation of healthcare. How COVID has accelerated our opportunities for that, and where I see us going forward together. I'm really sorry I can't be with you today. As an ex-scholar, I know the importance of these scholarship programs and the opportunities they offer for your career to take off in all sorts of planned and unplanned ways. They offer a real network of nurses and midwives who are as passionate as you are about making things better. And I still draw on that network today. So I wish you all the utmost success with your scholarship. And I'll move on to talk a bit more about the agenda that I've laid out here. So there are obviously some real key drivers for change that have been growing over the last few years. The long-term plan, the Minister for Health's tech vision, and our own CNO objectives all point to the need for a change in our nursing practice, a change moving towards a healthcare system that uses digital technologies and data science to both advance the practice of the care that we deliver for our patients. We need to change the way we educate post-reg and pre-reg nurses to be able to work in this new digital age. There are real opportunities for research that will promote nursing excellence, and it will require different leadership from all of us to enable us to really make a transformed digital healthcare system that's fit for the future, that supports patients, and it makes it easy for nurses and midwives to do the right thing every day. So if we come to the long-term plan, there are some clear commitments there in terms of digitising health and care, about shared care records. And it's really important that as nurses and midwives, we're involved in some of these agendas, because in order to share records, we need to think about how do we make some of our practice standard? How do we ensure that we have standardised nursing care that can travel with the patient across the care continuum? So interoperable data standards that enable that to happen, supporting variation where it's needed, but enabling the information that travels with the patient to mean the same thing wherever it lands, so that we can give our best care to patients. And also to share those records with our patients, enabling them to contribute to their care records so that we can see safe care improved as those risky periods of transitions of care are improved by the quality of the communication that we have with each other. This will require a workforce with different skills, digital skills, transformation skills, leadership skills. There are things that we need to do here at the centre to make things easier for all of you that are trying to lead this every day in your practice. All too often, I'm seeing too many nurses that are trying to do the same thing in different ways in many different parts of the system. And it's my ambition to bring you together to try and do this once and do it well. We want to have a vibrant ecosystem so we're not dependent on individual suppliers, and that comes back to our need for standards, for digital care plans and personal health records that are available to patients wherever they are. And the long-term plan pointed to the need for a CCO and a CIO on every board. But I would argue that we also need a CNIO in every organisation, making sure that the chief nurse is as informed about digital as she is about all the other elements of the board's activities that she needs to be, like the finance, or estates and facilities, or quality and safety. NHSX has taken up the long-term plan in its missions, which really articulate how this will make things different for people, making sure we can share information safely, making sure we can reduce the burden on the workforce, improve patient safety, give patients and citizens the tools they need to access the services they need, and improve productivity with digital technology, reducing time wasted. So what does this mean for us? And this slide about medicines, I want you to just think about it for a moment and think about, what does this mean for us? So we can see here how this clearly talks to the improvement of safety and the elimination of waste and the improvement for patients. and joining up care. But what it doesn't speak to is the amount of time that nurses spend administering medicines, 25% of their time, according to some studies. And where are nurses involved in making medicines management safer? Not closely enough at all. Some of these digital changes are led by others, and what we need to do is step into the space and have our voices heard to make sure that we are involved. So the other measurement in here would have reducing the time that nurses are spending administering medicines and increasing the time that they get to spend in relationship with their patients. But if we want our profession to be involved in this digital transformation, then we're going to need the workforce with the right knowledge and skills. The digital transformation should start at board level, and that means training for boards, including the chief nurse. NHS providers have a robust programme of training that those of you thinking about being chief nurses should really start to take a look at. It will become part of CQC well led that hospitals and other providers are inspected according to their levels of digital maturity. And X will work with the CQC to determine what that looks like. But you should be thinking about this all the time. Are we digitally mature? Have we introduced new risk with the way that we've transformed digitally? Is our digital system good enough to capture the individualised patient care plans that we need? These are the sorts of things that the CQC would be looking for. So we need to have ward-to-board knowledge and expertise to collectively lead. Often there are digitally interested nurses, digital natives, digital clinical entrepreneurs in your own organisations that you may not know about. These nurses need to be supported and encouraged in order for your organisation to move forward with its digital transformation agenda. And for those that are less confident, we need to make sure that they have the digital literacy skills necessary to operate in a world where working with technology and data will become the norm. The picture on the right is a picture of the digital transformation at UCLH, and you see one of my nurses working on a WOW with another nurse working on the WOW in the background. These nurses all had to be trained in order to work with the new technologies, and it's fair to say that there was some trepidation. But in 3 months, we trained over 10,000 staff, 3,000 of which are nurses and midwives, in order to be able to work in this way. And none of them would ever want to go back to the way they worked before, because what they say is they can access the information they need when they need it about their patients, that they've reduced the time they spend documenting care, and that they have lots of supporting technologies like barcode scanning to make things quicker and more efficient for them. We'll need digital leaders and champions, and some of those will come from this cadre of nurses. Some of them already exist and we need to support them. Some are yet to emerge, and that will mean starting with training our nurses at undergraduate level so that they arrive into the clinical area ready and thinking about how they can make things better and how they work with digital technologies. Make use of these individuals, seek them out. Arguably, we need a CNIO in every organisation. I'm committed to making that happen, and I hope to see that occurring in the next year or so. For those small group of nurses who have chosen to specialise in the design of these systems, we need to ensure that they have the necessary education and are accredited and recognised for their specialism. I wouldn't expect to see a diabetes nurse specialist without the requisite expertise in diabetes care, including the diabetes nurse course. And I would expect to see the same for this group of nurses. But today, that's not on offer, and that's something we need to work towards. At the moment, particularly in COVID, we see us all focusing on the technologies, remote monitoring, virtual consultations, virtual wards. But what we also need to think about is what do we do with the data? What's the opportunity that big data sets from electronic health records and other technologies will offer us in terms of using that data to transform the way we care for our patients, be that through analysis of the data, operational dashboards, research, or artificial intelligence, as we start to use the big data sets about the risk factors for pressure areas, for instance, to generate algorithms that will predict it instead of nurses filling in water low risk assessments. So you can see there's a lot of opportunity to move forward. And we've seen during COVID a lot of change. I'm sure you've all seen lots in your organisation. And you've seen nurses grasp it and run with it, and also lots of struggle. There is certainly a long way to go. And what we need to do is really reflect on this period and think about what worked well, what didn't work so well, and how do we take that learning to move forward together into a digitally enabled healthcare system. I think one of the exciting things about this year is that the CNO and NHSX decided they need a CNIO, me. And arguably, having a nurse at the top table within NHSX and within NHS England means that we can have our voice heard. But one person alone can't make the change. And I need an army of nurses who are ready to rise to the call to action to get involved in digital transformation and make things happen. And I already see that starting to happen. We've seen remote working become almost our norm at the moment. We've seen online meeting and events, and we've seen working from home. And this has really helped with some of those leaders in our organisations, maybe who aren't working with clinical systems, so haven't seen the imperative, but now see how it can enable them in their everyday work, and are therefore starting to think much more carefully about what does this mean for clinical work and how can we transform our practice. And we're already seeing that transformation. Video consultations in all care settings, virtual check-ins, video group clinics. And I see through the digital nurse network more and more nurses trying to access learning about how to do this well and support their patients well. And some really good debates amongst senior nurses, as well as nurses at the front line, about the sort of guidance and support we're going to need to, as we move to this being one of the normal ways we work, and thinking about how we choose to use this with purpose to extend our humanity and extend the quality of the patient experience, and when we need to think about other options. And so all this learning takes me on to my priorities, our priorities. I think what they point to is 8 key things that we need to pay attention to in the strategy that I hope that we can craft together, and the 5-year plan that we can shape to get our workforce ready for working in a digital space, and to inform what that digital space will look like in 5 years' time and beyond. It's clear to me that joining up care has really been enabled by remote monitoring. But joining up care is the fundamental work of nurses and midwives. And what we need to think about is how do we use our voice to make sure that this is done well. It's clear that we need to empower the front line, adopting the principles of the CNO's Collective Leadership Programme. And we've gone some way to that with setting up a shared decision-making council for digital nurses at the front line. And the stories emerging from that community are of significant change in their organisations that they want to share with others, so that we can grow and spread adoption based on their learning. These nurses all want opportunities for their careers to grow as nursing informaticians, so professionalisation will be really key. And we've appointed a nurse in HEE to lead on advanced clinical practice in nursing informatics. We absolutely have to reduce the documentation burden. And as EHRs emerge in lots of different ways, it's clear to me that that's not happening yet. And we're going to need to think differently about how we do that, adopting data standards as a fundamental principle for reducing the burden. All of this should enable us to release time to care, but always uppermost in our mind, thinking about the technology we need for the task that will extend our humanity, bringing people, process, and technology together in everything that we do. There's clearly an opportunity to improve safety, and thinking about our nurse-sensitive outcomes, definitely a great deal of opportunity here that I hope that we can take forward together to demonstrate the contribution we make every day to patient care. In addition, there will be the opportunity to strengthen the evidence base for nursing midwifery. If we do this well, we will be able to harness big data sets that will enable us to target care at those who need it most, support decision making by using clinical decision support within systems, and to support our research colleagues to use the data to create evidence about the ways we work and find new ways of working. And of course, the unique contribution of nurses is that we support patients with their function. We're not about disease, we're about empowering people to live their best life. So at the heart of everything we do has to be our ambition to enable patients to do just that, to live their best lives with whatever limitations they have based on their medical disease. I've told you a little about the Shared Decision Making Council, and I'd urge you to go to the CNO website and have a look at that. And I'll share this slide deck with you, but I wanted you to meet some of the nurses that are on that council. Everyday nurses providing care in difficult times during COVID, but making a real difference and taking the opportunity to use digital technologies to do so. So how are we going to do this together? Well, I think we need to build community and create a social movement. We know that there are already a number of networks that exist. I want to bring those together as a constellation of connected communities under the Team CNO umbrella with one voice, really clear about our direction of travel so that they can all be working on that through their unique and different lenses in their unique networks, but with one shared purpose: advancing and enabling nursing excellence. We can see that membership has grown through the COVID outbreak and that more and more people are accessing the network. And this tells me that people want more education, and I'm committed to investing more in these networks. As the National CNIO, I am working closely with arm's length bodies, our regulatory organisations and the Royal Colleges to make sure that we are all working together, again, using our unique voices that we have about our professions, but together as one voice under Team CNO, saying this is about making it easy for nurses to do the right thing every day, and it's about advancing our practice and making our contribution visible. I'm a member of the Oversight Board for Health Education England's programme to support the digital ready workforce. And there are a number of streams to that programme, as you can see. But what I do is offer challenge about why nurses and midwives haven't had access to all of these opportunities, why the applications are so low, why people feel it's not for them. And we are starting to shape different ways of supporting our nurse and midwife leaders, experts and the workforce to ensure that they are ready to move forward together. So this is a call to action for you as the future leadership of our health system to really embrace digital transformation and think about how you can make a difference and how you are going to work in a digital healthcare system supporting others. Everything about our practice is changing, so you can't rely on a small number of digital nurses to lead the change. This is going to take all of us. I am committed to championing the nurse voice at every level of the NHS, to promoting networks and learning communities, using one voice together, working with key stakeholders on things like training and education, and establishing advanced practice in informatics and growing our digital leaders so that we have a workforce not only embracing the technology we have today, but shaping the technology of the future. And what do I ask of you? Please ensure digital is at the heart of everything you do. Stop, think, could digital help here? Ensure ward-to-board nurse involvement in digital transformation. Stop, listen and ask. Identify your digital nurse champions and support them. Join networks, get involved in the digital agenda, and please share information and opportunities for development with colleagues as you see them. Thanks so much for listening to my thoughts today. I hope it stimulates some really good conversation amongst you as Florence Nightingale scholars, some of you digital Florence Nightingale scholars. I really look forward to getting the readout from the conversations that you've had, and I invite any of you who wish to connect with me. I've left my email address and my Twitter handle here, and I'm really looking forward to hearing more about you, your thoughts and ambitions for the future, and how we can work together to deliver them. Thanks very much, everyone. Bye-bye and have a great day.